good.
Yes.
Okay. Have any of you used a home blood pressure monitor in the past?
Nope. Yes.
Okay, so one yes.
Oh, no.
Yes,
Three
I-
no's?
my parents.
Yeah, okay, good. Well, it's the same concept, basically. And so what I suggest, and so let us know what you think, and Shola and I will kind of divide and conquer. So we'll divide you in two groups of two, and you'll each get a device, walk through the device, and practice the setup and explaining the process to one another. So you'll use one another as your your test patient, exactly. And then after you've done that practice walkthrough, then we'll do your checkoff. Does that sound okay?
One
Yes.
thing.
Mhm.
Can we go over the numbers again? Because that was, I know we went it yesterday, but that's new to me.
Okay, so tell me, so you mean like the
Like
goal cutoff
180
numbers?
over 90, if anything is higher than that.
Okay, so, good. Well, so let's go to the page so that we're all on the same page where it describes the expectation. May I
You
join
absolutely
you here?
can.
Okay,
Ma'am.
let's find the page and then we'll,
Oh, 140 over 90.
yeah, so that's for the normal values. And they're also, I think it was in Shola's presentation yesterday, and Shola, you correct me if I'm wrong, that we identified concerning elevated blood pressure levels, so higher than 180 over 110. Okay, so those are, and actually then there were low limits as well that we wanted you to be aware of. So, first of all, the normal blood pressure cutoff. So the goal for most patients is to have their blood pressure less than 140 over 90. Okay, so top number below 140, bottom number below 90. And there are some groups of patients that you might hear have a lower blood pressure goal. And so those are patients who have kidney disease or diabetes. Some guidelines have recommended lower blood pressure cutoffs for those individuals. So you might find that you're seeing some patients who have slightly lower, but that's usually 135 over 85. Below that is the cutoff for those individuals. But for the most part, 140 over 90 is what you need to keep in mind. Now, if you're talking with patients or you're teaching them and you're checking their blood pressure and their blood pressure is elevated, so anything above 140 over 90 means their blood pressure is not controlled. So actually at or above 140 over 90. And so as you can imagine, so what are some things you would want to reinforce in that case? So if their blood pressure is 160 over 88.
Can we, at that point, can we do the confirmatory? Will you do three, or does the machine already do that?
So the home blood, that's a good question. So if you were in the clinic, that's exactly what you would do. You would do the 3 confirmatory measures and then use that average. And you'd ask them to sit quietly for 5 minutes before doing that confirmatory blood pressure measurement. That's exactly right. So, and even in that case, so you recheck the blood pressure and it's 158 over 86. So it's come down a little bit, but it's still elevated. What are some things that you might discuss with the patient?
Eating habits.
Okay, so
I would try to identify some of the foods that they're intaking and see are they high in sodium, because that does mess with your blood pressure. How often are they getting out of the house? Are they doing any exercise? So I would inquire about those things. I would still, once I get back to the office, I would definitely give those numbers to the provider and see on the medical aspect what they would suggest. But I also would talk to the nutrition. We have a nutrition dietitian. I would speak to them, but I would, I would discuss with the patient and try to see If maybe we can come up with some goals that we can implement into their lifestyle, see what fits them, see would they be okay talking to the nutritionist, you know.
That's wonderful. And there's one more really important thing to ask about.
Are they taking medicine?
Are they taking their medicine? Exactly. And it's really important not to assume, because, well, exactly.
Right.
And so, and there are some ways to ask about that. So have you talked about promoting adherence yet? Has that been something you've discussed? Okay. So an example is asking the question in a way that patients are, so you don't put them on the defense, by asking about, taking your medicines. And why didn't you take your medicines? That's not going to encourage some discussion. So, one way to ask it is to say something like, it can be really hard for most people to remember to take their medicines every day. Have you, how many times in the last week did you forget to take your medicine, or you didn't take it for some reason? So that way, you're letting them know that a lot of people miss taking their blood pressure medicine, so that already they're okay with talking about it if they don't. And then you also ask it in a way where you're not just saying, did you take it? You're asking it in a way so it's not just yes, no, it's how many times in the last week did you forget to take it? So that kind of opens it up for you to talk about, well, what were some of the reasons that you forgot? Was it that you were rushing out of the house, didn't have time to eat breakfast, and you always take it when you eat breakfast? Or, you can walk through some of those barriers. But when someone's blood pressure is elevated, it's really important. So just as you've identified, talking about the sodium in their diet and physical activity, but importantly, are they taking their medicines? And help them to explore some of those barriers. So then the other blood pressure values that are important for you to keep in mind as well is the higher limit. So if the blood pressure, as I said, is 158 over 86, that's elevated, and we want to address that. So we either want them to be, more engaged in taking their medicines. They might need to actually have a discussion with their provider. It may be that they're taking their medicine and they need a dose change. So you want to certainly reinforce that. But also, there may be times when the blood pressure is very elevated and it's at a concerning level. And so that cutoff, because it's important for you to know and for you to be able to tell the patients as well, it's above 180 for the top number and above 110 for the bottom number. So systolic above 180 and diastolic above 110. So when blood pressure gets above levels like that, you want to encourage them to call their provider really right away and let them know that their blood pressure is high. And if they acknowledge, well, I haven't taken my medicine in 3 days, I ran out, or for whatever reason, then reinforce, your blood pressure is very high, this is very concerning, and it's very important for you to take your blood pressure medicine so that you can decrease your risk of having a heart attack, a stroke, or other negative effects of uncontrolled blood pressure. If they say, I am taking my medicine, then they definitely need to call their provider, because it's likely that they need some adjustment in their medication. And if they're having these elevated blood pressure at this level, and they're having symptoms like
headaches, nosebleeds, visual changes, and maybe you have weakness or chest pain, those things are indicative of target organ damage, and they need to get to an emergency room as quickly as possible.
Same with shortness of breath.
Shortness of breath, there's a range of that.
And all of that, I think, is reinforced in the slide. So feel free to look back at those, and you might even make some notes for yourself for those key cutoff points, because that'll be important to know, and you'll want to have that fresh in your mind as you're seeing patients, so that you can counsel them appropriately. Also, at the other end of the spectrum, blood pressure can be too low. And what did we have the cutoffs? Is it below 80 and below 60?
Below 90, 60.
Okay, below systolic below 90 and diastolic below 60, and
But
with
with
symptoms.
symptoms.
With symptoms. And if someone has that low blood pressure but they feel fine, you might just reinforce to them, why don't you call your doctor and just let them know what your blood pressure is now? Because it may be that, maybe they've lost 20 pounds and they're able to back off on some of their medications. Maybe they don't need to push their blood pressure quite that low. But importantly, if they are having symptoms of lightheadedness, dizziness, feeling faint, and their blood pressure is that low, they really need to, call their doctor, and, if the symptoms continue, then go to the emergency room or the hospital. Okay? And those are really the most important parameters, I think, to make sure that you're aware of and to make sure that the patient's aware of. Because as we're coaching them to monitor themselves, we want to make sure that they understand what is the goal they're trying to get at, because that actually helps them reinforce, oh, this is great, look, my blood pressure is at goal today, so this medicine's working, I'll keep taking it. It's a very positive reinforcer, especially when they are achieving control or at least showing improvement in their blood pressure. Did you have any other questions about the blood pressure values? Okay, well, let's dive into using the devices.
So let's just see.
Yeah.
So this is what it looks like when you get the pack unopened,
Beautiful.
right? So you open it and the first thing you see is the cup. Okay. So this is the cuff. It's a one size fits all within the range, right? The next is this manual, getting started, which details it details BP cutoffs and how to set up, essentially setting up the date and time, which is really important because for this home blood pressure monitoring, as we discussed yesterday, it has a memory and it's going to be storing blood pressure readings and values for specific days. So you want to have the time and date set up as soon as you open the pack. So that's sort of like the first thing you do.
Sheila, I'm sorry, I wasn't here yesterday. My name's Mary, by the way, and thank you for all your help. I was wondering, for our patients who have low vision, the monitors are going to be great, but is there a way we can get the instruction manual in large print?
Absolutely. I think everything there. We have a participants packet, something to take home.
Okay.
So for people who have maybe difficulty reading, it's just easy to blow this up.
Yeah,
It will be easy
some
for
of
them
them.
to read. Everything we have in here is detailed.
Thank you. Yeah.
Sort of like
That's a
quick
great
summary.
idea.
I'm sure you have it in your packet. Home blood pressure. Okay. So. Okay. And this is the device. It comes with batteries and an AC adapter.
I'm sorry.
So you can plug in or use batteries, but I recommend that you have the batteries in there.
Do you know what the life period is of the batteries?
They are alkaline batteries, so
Okay.
they last. Then of course you have the manual. So the manual contains things like instructions and error codes, because we can't print out all the error codes. So if if participants or a patient complains that they've seen error codes on the display of the device, you can just go to the error code section and see what each error code sort of corresponds to, so that I can know if it's a problem with the device or it's a problem with positioning or something, that needs to be done. This sort of tells you. So that's what we have in the pack. So the steps to go through will be first, you want to be sure that the cuff fits. So we need to do an arm circumference measure, right? So we check the arm circumference to see if it's within the range 9 inches to 22. We use a measuring tape for that. This is a standardized measuring tape that we provided for everyone.
Thank you.
I'll describe how that's going to be used in a moment. Then the next step will be to configure the device. Important things to do: 1, set a date and time, as I said. And 2, you want to set it to the three readings mode. We want to take averages for the purpose of this study. If you do not do that, it's going to be taking just individual readings, just take one reading and stop. But if you wanted to run 3 successive cycles and take an average, you need to set that up here. It's called a true read function. Okay, so those are the things that we do, measuring the blood pressure inside. Any questions at this point?
I did, I'm sorry.
Oh,
You're
absolutely.
probably wishing I wish you wasn't here today.
No, it's fine.
Going back to the instruction manual,
Okay.
is it, a lot of manuals now, it's in English on one side and Spanish on the other, is that how that one works?
Yes,
Okay, thank you.
English and Spanish.
Thank you.
Good question. So I think we'll have a big
Yeah, I was just gonna say, I'll pass it around for you to.
Thank you.
And you can see there's even a more simplified basic steps of blood pressure measurement tool there.
device and batteries. This is the manual. So you can just
No, right. Well, that's where having the,
Yeah, I
the
would
more
know
basic
read
version.
this one.
Well, and that's why it's also so important to walk through it with each patient when you teach them how. Because you're right, that, instruction manuals can be very complex, even if the process or the procedure is really not that complex. It seems a lot more so when you're trying to struggle through a manual like that.
Is it possible, can we get our own copy of the manual and the instruction guide in case they call us and they're asking us questions? Like I've got this error code and I've done whatever it says, because I'm sorry, I'm visual.
No, so actually you'll each have a device.
To keep with us.
I believe so. Isn't that correct, Ariel?
I'm sorry, restate
That
your
each
question?
of the community health workers will have a device,
Yes.
a home blood pressure monitoring
Yes.
device.
Okay, wonderful.
Each person in the study, I'm pretty sure each person in the study will receive one of these devices to keep at home with them,
I'm sorry, I thought the community health workers were also going to have,
to carry around with them.
Mhm.
I don't know the answer to that question, but
Okay.
I'll find out and I'll let you know.
okay.
If anything, if it's just like the instruction manual with
Right.
the error code,
Okay.
because I'll know we'll get the phone call.
No,
So
I
are you
think-
saying that
I think
summarized in
we
the
should-
document as well?
Arrow codes, no.
Okay, okay.
I think we should get one too, because I can imagine me giving this to my client and then I come back a couple weeks and saying, hey, where's, what I gave you, and they're like, I gave that to my sister because she needed it,
Oh no.
so.
Or, yeah, and it's like, I did everything the manual told me to do.
Well, actually, you bring up a really good point. And so I think it is important to reinforce with patients that we're providing this device because we're really dedicated to partnering with you to get your blood pressure under control, working with you to achieve your goals. And so it's really important that you keep this device and use it, yes. You may remember yesterday we talked about making sure that if they do have other family members who use it, to switch it to patient 2 instead of patient 1.
Right.
And that's, where is that?
I just sent an email to Chittima, so I'll let you know when I get a response.
Oh, here, right there.
Okay.
So see 1 versus 2 on that switch. So they should always be 1. And then if someone else uses it, they just switch it to 2. And then before they use it again, switch it back to 1 for themselves.
How did they have
And-
decide who's two.
Any other
They can both
person.
be two, just to make, exactly, but the patient should always be one,
Always
and
be
no
one.
one else should be, otherwise we'll get confused in trying to interpret those numbers.
And I apologize for not being here yesterday, but what if we do
Okay.
have an obese patient?
So
So
that's a great question, we did address that yesterday. So only patients with arm circumferences as outlined here, so 22 to 42 centimeters or 9 to 17 inches can use this. We do not have home blood pressure monitors that accommodate arms larger than that. And so we want to be very sensitive to patients and certainly not make them feel negative, but let them know that we don't have a home blood pressure monitor for them that is appropriate for their arm, but we want to work with them to identify another way to get regular blood pressure checks. And so what we'll do is work with them to arrange for them to come into clinic and have efficient blood pressure checks using the clinic
so
monitoring device instead.
Two
Well, I guess if they both
I
arms.
don't know how they're gonna,
setting up the date and time.
determine who's gonna be in the city,
Mhm.
who's not gonna be in the city, but like it's still very, I'm sure.
Yeah, it's about
I don't think they're gonna be in.
We want, yeah, so I would have to look back at the inclusion criteria. I don't remember specifically that being excluded, but I would assume they'll have one arm, but maybe not. Or they might have fistula or something like that, where they're not supposed to have blood pressure checks. But I think those individuals probably are not included in
I
our
would
study.
think so.
But we could, that is an important question, but if it's due to the size of their arm, just reinforce to them that we want to work with them to make it, easy for them to come in for blood pressure checks efficiently, so that, you schedule them so that they can come in, they don't have to wait a long time, and, but to be able to, yes, but to be able to monitor their blood pressure in that way, using the clinic devices.
Sorry, I was listening, eavesdropping at the time.
Oh, okay, good, yeah, no, good, I'm glad.
So it was just.
Yeah, so that's great, yeah, get it set up, and
So you
then
just set it to the appropriate time. That's just
you can kind of practice with one another, and then we'll,
Today's 5:25.
No, it's not 3 to 7.
Oh, so,
No, I just left it at 7.
I thought you were.
So I can set it up.
So where this is the 7th?
Yep.
Okay.
That's a little
3:18.
closet.
3:18.
3:18.
We can keep it 3. Or are you doing that?
Yeah, you just,
We did it, it's not gonna like mess it up.
then those are the up and down.
And so
His-
this is the 3rd.
Perfect. So you have the time set up. Then go through this. This is how to set it to take 3 consecutive measures. As a true read.
That's the average.
Yeah. Right now the true read is off.
Okay.
Right.
Maybe it's about
So
show off.
you set it to on.
Huh.
Get this
That's
confirmed.
smart.
Right. Now what this
We
means
need a
is
manual.
60 seconds interval. Like the gap in between readings should be 60 seconds, 1 full minute, but we want it to be 30 for the study, so you just make it at 30 seconds.
Okay.
Oh, so it's incremental.
So that's it.
And this will be permanent for,
Yeah.
once you set it up? Okay.
Once you set that,
Okay, we want it to be 30.
30 seconds.
Okay.
So you can just repeat it.
Okay.
Okay, so those are the 2 things we want to sort of set up before we start, the date and time, and the true read.
We eavesdropped, so we set it.
Oh, done?
You can check this out.
Perfect.
And we share.
The
so
30
not-
seconds.
So.
Oh, done? Wow, get an A plus. Okay.
So when you set for the true read, then what happens is, because I saw this happen when we did it, so we just continued, it's gonna go through this again.
Yeah.
And we'll just explain to the patient that,
But once you set it up this way, this stays that way, you don't have
Well.
What's this button?
And that's the memory button.
Okay.
So for your last reading, you just hit this.
Oh,
It shows-
So they'll just read it their last.
No.
Yes. the last reading.
But it will show the time or just the actual reading?
I'll show you reading.
Oh, wait, but try that out. But I think it shows everything. It's just like that, so it doesn't show. It just gives you the readings. But if you want those details when you upload it onto the app,
Okay.
I'll look at the clock.
Well, cause
no, you know they have it logged, right? So.
I just wouldn't like if I said, oh, when's the last time you took it? And she said yesterday, and I think the reading is like a week ago. I want to be able to see that.
So this is what they get for those who want to have it written down.
We have those. I think I saw that.
Okay. So once they take the readings, get it, do the 3 readings, and whatever this is displayed on the device, just fill it in there.
Okay.
140 or 20.
Okay.
Right.
Now, I have a question. Should the patient be responsible for this, or should we be responsible
For
for
the patient.
the patient to
Yes.
keep track, and they will
track.
take it with them
Yes.
to the doctor?
Take it with them.
Because they're supposed to be doing their blood pressure reading even when we're not around.
Right.
We're just showing them how to do it.
We're just encouraging them to
Right.
write it. They're going to write it in front of me.
No, they're not going to be, you're not going to be there every time to take the blood pressure.
That's very true.
Right,
Yeah,
so.
I mean, the first time
The
you
first
can,
time.
yeah,
Right.
and then you just have to remind them to put it, you know,
Put it in
I'm
the
gonna give them a little folder for them.
Can I ask a question about like having a smartphone and being able to download the app to be able to transfer the recordings of the BP?
Yes, I think we have
Is that in there?
instructions in
Okay.
there how to do that. Okay, so this is it. So this is what the app looks like.
Okay. So once we get aligned and stuff with our patients, we can just go in and.
Yeah, so
Okay, that's it.
the app is available for free, so you just download it and so
Wow,
think of that
that's
as
cool. That's pretty cool. I'm
Yeah.
interested.
But for those who are not as tech savvy or have problems with that, they can just use
Okay.
this.
Yeah, that's the end of the packet that she gave.
And it has to be emphasized that each time they take a measure, they have to.
Same time. The people reinforcing that.
Absolutely.
Gonna have to
Yeah,
keep their arm
and
over
we
that
emphasize that it's important for them to know
Didn't they
that
cover that this
we are not
one?
essentially using individual day level readings like that.
We'll keep it on there.
So it's an average of 5 to 7 day average. That the physician makes determinations based
And
on.
make sure they keep it on one for themselves.
One for themselves. One
And I think
for
just about every
themselves.
time they use an adult sleep on it.
Yeah, go
I'm like,
through
I
the
know
whole
they're gonna check
process.
me.
We have to use something like this.
People that do mine, they use.
Yeah, the app allows you to.
The cord.
Oh,
So,
Is that what
are you
they
asking
did
where it should
yesterday?
be?
So there should be a mark on here that gives you and the patient a little coaching. Oh yeah, so it's actually here. Sometimes it shows a special little notch, but this should be. It was so cold earlier today. It's like you don't know how to dress these days. So you want it to be actually approximately 1 inch above the brachial artery. So it's above the 1 inch above the
Above.
bend and over
the flexure.
the brachial artery, so
Okay.
right in that range.
And the cord should be like, I'm going
Down.
by the cord, okay, but I.
Yes.
Got it.
That's consistent with what it shows there, right? Yep.
Yes.
It is saying the same thing, right? Okay, yes. And remember, if you have a patient with a funnel-shaped arm, so larger on top, it's okay to wrap it so that it fits snug to the arm. You don't want to be able to fit more than 2 fingers underneath the cuff.
So before we do that, this, yeah, this is how you make the determination of whether the clock is the right fit, right? Because it's the one, it's 9 to 22, so you.
What about the slope?
Okay, so you, let's go step by step. Okay.
That sounds like a good plan. Let's walk through it once, step by step, and then we can.
Oh, you're.
I like how they you have the picture here.
Which one? This one? The
Okay.
You want to go through the checklist?
Oh, and I'll see how they have.
Where is the checklist? Why don't you want to just walk through that?
This is mine, right?
That's the one you gave me.
Okay.
Does that one come with the
Yes.
Okay.
This is it. So this is this. So this is what we do when we're training. First, you fit the cuff. Then you go through setting up the device. Then you teach them the measurement technique. Then you tell them how to record in the log app. You talk about the action guidelines, what Cheryl described earlier. Your BP is greater than 180, 110, and you're having symptoms, what do you do? Right. Then, of course, you go through a checklist with them to make sure that they know how to go through all the steps. Right, so that's how you go about it. First, the cough. We need to make sure, it's really important to make sure that the cough is the right thing. Because if it's not, then we're not going to be getting correct readings. Right, so the whole essence of it will be defeated if this is not. Then, setting up, measurement technique, everything we discussed that pertains to the same way the clinic measure is done. You sit, no talking, no crossing, don't cross your legs, and your arms supported, the 7 steps essentially. Then recording is on the log. Action guidelines, what to do, when to do it, right, and checklist. So, ensuring the cuff fit. So we're going to have the participant remove any clothing on the upper arm to, yeah, perfect, to reveal a bare arm. We'll have the participant please stand.
Don't let me step on your toe.
Okay. Oh,
So is our t-shirt purple?
oh, you like purple?
It's important.
Okay. Holding their relaxed forearm horizontal and parallel to the floor. Good. Right? This way. So it's going to be in the L-shaped position.
Like you're holding the tray.
So you're going to use the standardized measuring tape, this, provided by this project, to measure the circumference of the arm at the midpoint between the bony protuberance at the shoulder and the tip of the elbow. Right? Just relax. Just like, good, perfect. Right, so the midpoint of this, that's the mid arm. What you want to get is the circumference. So, bony protuberance here. To avoid bias, do you use inches or cm, centimeters? Cm, inches?
I usually do.
Oh, okay, so it doesn't matter. Because for me, I don't really think in inches, right? So I go this way, then flip it to see. Right, because your inches, it doesn't really register with me. Okay, so this is what we do. Mark the midpoint. I would advise that you use maybe a calculator or something, because it's not every time you get 5 cm that you can just divide by 20. It's 2.5. There are some numbers that it's just easier for you to use a calculator. Maybe I'm not good at math, but I use a calculator most times. So you do that, you get the midpoint, and then you draw the tape around. You mark it. And get the circumference. Make sure it doesn't indent the skin. Right. Then we'll read that off. In inches. Here we have 10.5. So she can use it because this is 9 to 20. Congratulations. Right. So for people that have arm circumference less than 9 inches, you can't use this. Right. She has 10.5 at the mid arm circumference, so she can use this. So you can proceed. Okay. Do you want to demonstrate?
And remember, the first time that you're introducing the machine to a patient, you'll want to actually go through the device too. And so describe to them, for example, what does the start-stop button do? The assumption is that you've helped them set up, you've made sure the battery is in. Explain start-stop. Explain the user ID button, as we talked about. So where do we always want the patient to be? Number one, exactly. And then the function of the memory button. So that's going to, so again, patient 1, and it's going to list the prior blood pressures. And,
Yeah, we've not taken any readings.
oh, that's okay, that's why it's not showing anything,
That's why it's
okay.
showing.
But you'll want them to know that they can use that memory button to go back and review their blood pressures. And let's see, the up-down function, so that's just going to allow them to progress through the past blood pressure measurements as well. And, well, the function of the cuff. So explain to them, you've got to sit still, it's going to take a few minutes, to fill, for the air to inflate the cuff. You need to remain still until it's totally deflated, because that movement will actually influence their blood pressure. And then make sure that they understand the air jack, and that this has to be connected, and it has to fit properly in order for it to work. And what would you tell them if they, if it's inflating and it's becoming painful? What can they do? Exactly, they can just push the stop button, so inform you if you're there, but if you're not there, because they're doing it at home by themselves, let them know that is an option to press the stop button, so that they can stop that inflation if it's painful.
And then that won't count as a reading because it didn't go all the way through the process.
Correct. And you know, sometimes what happens, especially if people they're moving around and they're kind of active or wiggling during the blood pressure measurement, the machine actually starts inflating more. You'll hear it stop, and then it'll go, it starts popping up more. So remind them, sit very still and relax during blood pressure measurement, and that helps to prevent that overinflation. Okay, so you've walked through the device. Any questions about any of the
What does this button?
buttons? Or any of the functions here? No. Okay, great. So you're going to walk through that so that the patient understands. And then what are let's do a little refresher. What are all the key points about good positioning for blood pressure measurement?
Well, yesterday there was a 7 to make sure that the patient was at the level of the heart, elevated with the heart. Also make sure the patient posture is good, his back is towards the chair, feet is flat on the floor and not crossed. Quiet, right? The patient is quiet. And
For how long?
Through the removing out of the process of the blood pressure reading.
Right, but before pressing the start button, how long should
5
they be?
minutes.
Exactly.
5 minutes. So just making sure that the posture is good, that they're sitting up straight, they're relaxed, their arms level, if they're not talking or speaking while the machine is doing the readings, and they're relaxed.
And there's one more thing that's on that list of 7. So what are the things that they should avoid for 30 minutes before checking their blood pressure?
Smoking.
Yeah, there's a lot. That's okay. That's why we go through it. And you know what? It's okay also to have a little checklist for yourself, so that and after you do it a couple of times, you'll become much more comfortable about what are all those key steps. But you were almost there. So just and it's there's kind of a fine line there too. So the blood pressure will be more accurate if they have not smoked cigarettes or drank alcohol or caffeine for 30 minutes prior to the blood pressure check. Now, is it better to have a blood pressure than no blood pressure? Yes, probably, but we want the most accurate blood pressure, so we want to make sure that they know when they should check it to make it the most accurate. Oh, and one final thing, empty the bladder. They also should have an empty bladder before blood pressure measurement, okay? And you want to make sure that you teach them that, because a lot of people don't understand those key concepts of accurate blood pressure measurement. So it's really important to make sure that they learn that from you, because they may never learn it if they don't learn it from you.
And I think for some people, it's just automatic. When they sit down, they cross their feet at their ankles, and they don't even realize that they're doing it. So that was when I was in the doctor's office, that was the big thing. It's like, you crossed your feet. Uncross those feet.
Okay, so those are the key steps. So you're going to make sure that they also understand that either the battery has to be working or the device has to be plugged in. And you know, it may not be a bad idea just to remind them to plug it in when they can, when they're not using it. That way it will always be functional when they need it. And what are the best times to check blood pressure? Actually, best time may not be the best way to ask that, but if you're going, when we ask someone to take blood pressure 5 days in a row, for example, when would we like them to do that?
I remember yesterday we said make sure that they stay consistent within a time. Like if they get up in the morning and check it at 10, you know, be consistent the next day 10 and 10, and stay consecutive. But would morning time be a good time to take action?
Exactly. So actually it is. So, and we want to know because some individuals have a normal variation also in blood pressure. And so that can be helpful for us to understand. And it allows us to look at how the medications are working at different times in the day, you know, depending on the kind of dosing that they have. And so a morning check and an evening check is ideal, to check it twice a day for those 5 days that we're asking them to check. And many of these patients, we're actually asking them to adopt this as part of their everyday management of their high blood pressure. And so, you know, you want them to help build it in with their routine.
So for the evening check, it's either 30 minutes before dinner or 30 minutes after dinner, whatever they prefer to do, basically. Not right before they go to bed.
Well, I think it could be right before they go to bed. Yeah.
Yeah. But they just need to make sure that they're not eating within 30 minutes of taking it. And whatever time they decide to take it, try to stay true to that time.
Okay.
And just to touch on what can help you sort of remember the steps, we discussed yesterday, prepare yourself, prepare the device, take your blood pressure, so that you don't forget to empty your bladder or forget to exercise, eat, all of that. So you know that you need to prepare yourself and prepare your device. Make sure your switch is set to 1, right? Plug in the device, set it on a flat surface, you know, all those things have to be in place before you sit down to take a 5-minute rest and take your blood pressure.
Do we have a cheat